Health and Wellness Show, where we focus knowledge on health and wellness to help you to ensure a more productive and healthy life for yourselves, your families, and your employees. Now, the conversation today is about reconstructive post-oncology surgery. Now, this presenting and content partnership is with KPJ Ampang. To bring an expert lens to this topic, we have Dr. Fatimah Mohd Nor, plastic and reconstructive surgery and anesthetic surgeon from KPJ Ampang Puteri Specialist Hospital. Dr. Fatimah, welcome to the show.
Hi, Brian. Thank you.
Now, Dr. Fatimah, could you start by yourself and your training?
Okay, Bismillahirrahmanirrahim. Assalamualaikum and hi, good evening, good morning, evening. I mean, all over the world. Okay, thank you for giving me the opportunity to be interviewed in this such a very great interview. So I'm a resident plastic and reconstructive surgeon and also aesthetic surgeon in KPJ Ampang Puteri. Actually, I've been in this field since last 16 years in medical field. And then I'm doing this medical degree and also master's in surgery, specifically on plastic and reconstructive surgery for last 6 years. And I'm start working in general hospital, a lot of reconstructive work. I'm doing for 3 years there in general HKL. And then I've transferred to National University, UKM. And Alhamdulillah appointed as a head of unit under the Department of Surgery. And then I'm joined KPJ for last 2 years. So here I am.
Okay, so you've got extensive experience. You have a lot of cases, particularly you have to deal with AL. You were working very, very hard. But can I ask you, Dr. Fatimah, what inspired you to firstly be a doctor and then after that specialize in plastic and reconstructive surgery?
Okay, basically, I'm thankful to my mother and father who really encouraged me to be a doctor since my very early, means after my SPM time also, they already encouraged me to be a doctor. Why? Because it's always you can help all the mankind, do goods, and everything that related to human. Okay, and then after that, after about 5 years, then I pursue into plastic surgery. Why? That's where it's become, why I choose this is related to my experience working in general hospital, training, all that. So I've been seeing a lot of trauma, all this a bit severe because I'm in a general surgery department for 4 years. And I do lots of operation that related to general. Then sometimes being a mother and also a wife, so I need to specialize my things and my priority. So that's where I'm pursue in this field as a plastic and reconstructive surgeon.
Okay, could you start by telling us also then, because a lot of people don't know the difference, plastic surgery and reconstructive surgery?
Okay, actually plastic and reconstructive surgery is 2 different parts. Means reconstructive, plastic is a very big umbrella. So we divide it into a few sections, right? It's head to toe surgery, you can do everything. It's just reconstructive is more about when we try to repair, become abnormal into normal back.
Okay.
Okay. So the word plastic is from Greek word where we it means to mold. Okay. So we can, yeah, so it's a plastic we can mold. So for example, easy to say, if let's say we have a breast cancer patient, so patient remove the breast, right? So I will help people to take abdomen, for example, abdomen tissue, and then we mold it to be a new breast. So I always say it's like 3-in-1 surgery. Patient have, if let's say the reconstructive and also oncology doing at the same thing in the same time, it's become immediate reconstructive, right? So patient got three things in one time. First, remove the breast where the cancer is, and then she had a new breast because we take a new part of the body and transfer to the breast, and then she also get a tummy tuck so that she can have a flat abdomen. Yeah, so it's a 3-in-1 surgery.
I see. Now, so you've mentioned one type of surgery for cancer, essentially, if say the breast.
Yeah.
Could you give us some, besides that, other cancer reconstructive surgeries and also reconstructive surgeries?
Okay, reconstructive surgery actually can help repair the changes to your body from your cancer surgery. For example, you have a head and neck tumor. So let's say I had a BCC or any pathology over the jaw area. So we need to remove all that, right? So there's no jaw. So how can you shape your face back? So as a reconstructive surgeon, we can help by taking a bone from your leg. It's a special bone we call fibula. So we can transfer that bone and shape it into your jaw. So you can get new jaw and normal face shape.
Okay, so that's one example. How about when it involves, for example, if you've got nose cancer or something like that, how do you then reconstruct the face?
Okay, very nice question. And there's a case that we do. Let's say patient have SCC. SCC means squamous cell carcinoma, whereas it's a cancer can invade into the bone, soft tissue, and also deform the area. So we need to remove it, right? So nose is a bit complicated reconstruction. Why? Because nose is at the point of our face. Nose already have 7 subunit, you know. So we need to replace it. It's not easy. So first we need to see what component it have. It have cartilage, bone, and skin. So where we going to get this same nose? Okay, we cannot get anywhere else in the body because we have only one nose. So what we usually for nose reconstruction, we need to do stages. So first, sometimes we just put a bone or cartilage. Okay. So cartilage we can get from ear, we can get from ribs. We have cartilage there. We can get from inside this bone. There's a mucosa. We also can get cartilage from there that make you septum whether it's straight or bent. Okay. So we can get from that. So we can shape as a ella. So there's a few procedure that first we make a ella, then we do bone, then we do soft tissue. For soft tissue, we can take from the head. So we can transfer from head and mold it like a nose.
Okay.
Other than that, we can also use an implant. We can take implant and then we wrap it with the skin from your hand, from your abdomen, from your thigh. So we can transfer everywhere, any parts. All our body is a spare part. So we can use it to mold it as a new nose. Yeah.
As a layperson, always think of perhaps breast cancer and then the need to reconstruct breast, that whole procedure and how it impacts patients.
Yeah, this is my personal experience. It's really actually it depends. The impact depends on the patient individual. Let's say the patient is younger. I mean between 30 to 40, or 40 to 50, or 50 to 60. You see, and the youngest my patient I've been reconstructed is about 20 to 30. So you see, from the very early, if they detect as a breast cancer patient, so how can they face their daily activity, their future? Anybody going to marry me? What happened? If I can breastfeed the patient, the baby, if I get married, and a lot of things. So not to say about the job also. If let's say they're working in the front liner where they need to meet people, marketing side or service, so they need to be confident to mix up around, right? So they need self-confidence to help in terms of their daily activity. So when we offer this reconstructive surgery in same time with the cancer removal, it's really impact their life. Yeah, I can see that they really appreciate, and it's a life-changing procedure.
So this is where, for example, like KPG Ampang Puteri, you probably do it then, as you said, together in a more holistic fashion to then support the patient, because emotionally uncertainty and fear and so forth.
True. I work very close to my breast and endocrine surgeon, Dr. Anita, and also my oncologist. They always refer me a patient before the operation so that we can discuss, at least they have a session to talk, to discuss about whether we want to do immediate or delayed. What does it mean by immediate or delayed? Immediate means when they remove the operation, they remove the cancer, then I immediately do operation. Or we just wait until the patient complete all the chemo, radio, and then surveillance, everything complete, then they come for delayed procedure for reconstructive.
Okay, so how is the impact to the patient's health? Because obviously the outcomes may be different if you wait versus wait and all your chemotherapy and so forth versus doing it immediately. How does the patient make a decision?
Yeah, there's a few considerations that we need to give the option to the patient. Okay, if we want to do immediate, we need to see how severe the cancer is, whether it's stage 4, whether it's already mets to everywhere, whether it's very early or it's just a simple one. So for a simple one and very short procedure, axillary clearance and also removal, then we can do immediate. But let's say if the cancer is already metastasized or go to anywhere else, the outcome is not good, then it's not a good decision to do reconstructive in the same time. So that's where the early discussion with the reconstructive surgery is very important, whether we proceed as immediate or not.
Is reconstructive surgery for everyone? Highlight some of the risks to patients involved in reconstructive surgery.
Okay, a few things need to be considered before we proceed with the reconstructive surgery. What is this? First must be age, whether it's suitable or not. If let's say it's a bit old age, means 60 above, sometimes they have comorbidities like diabetic, hypertension, ischemic heart disease, and sometimes asthmatic. So the long hour period of surgery, let's say first breast surgeon will do operation and then go to reconstructive, it takes a longer operation, right? So when longer operation, then their old age cannot bear with the long operation surgery. So we might do delay. Okay, so we need to consider whether it's age, premorbid condition, and also who going to take care of the patient, and then whether she can comply to the whatever instruction we do after that. And then it's also related to what kind of job they do. Because let's say for those who really need go to work back as a normal, there's no much time for recovery type. They always agree for one operation, everything settled. And also not to forget, it's about cost also. Usually in one cost, in one surgery that we combine together, the cost must be much, much higher as compared to we separate it. In terms of cost a bit different. Whereas if let's say in long run, 2 operation will be much higher actually. One operation will be less in terms of cost, because same time operation with same anesthetists, and post recovery operation also same.
Yes.
So it's you can take leave also shorter, so everything good in immediate. But in long term, let's say if do immediate, but at the end of the day, the complication risk is more.
There's higher risk of complications, isn't it?
Yes, because long hour surgery, there's a risk of embolism, patient not walking. We need monitoring more intensive. Usually post reconstructive that we do immediate, more than 5 to 6 hours. we need to monitor it at least 24 hours in ICU. So 24 hours to 48 hours sometimes, and sometimes can be longer if patient not stable. Yeah,
Okay.
so we really need to see individual patient to patient basis.
So from a risk management standpoint, I think it would be better to separate the surgeries.
Not really. If let's say it's early stage of cancer, stage 1, stage 2, it's really good to do in the same setting. And
Okay.
in terms of insurance coverage also, sometimes they are no problem with immediate, because it's like things that we need to close the wound. How can we just operation and leave it open, right? So we need someone to close. So that's where reconstructive surgeon it's role there. So it's one time insurance can cover everything in one surgery. For delayed, sometimes insurance company need to assess whether it's a cosmetic surgery or really reconstructive or the other way around.
That's a very practical consideration to make it. Now, Dr. Fatimah, what are some key questions if we need to ask a surgeon before going through reconstructive surgery?
Okay. A few questions you need to ask, because usually this area is not is the area of expertise where not every hospital have. Okay, for example, for government hospital or in private, not every hospital have a reconstructive surgeon or plastic and reconstructive surgeon in that particular hospital. So usually I recommend for those who want to underwent the reconstructive surgery, you must ask the surgeon, what is your experience doing this type of reconstructive surgery? How many operations you have done, how often you do, because it's really highly technical, specialized. Because we need to do operation under microscope, you know, it's less than 1 mm size of vessel that we need to anastomose.
Okay.
So it's a really technical demand. So one of the questions you should ask, what is your experience to the surgeon? And then what type of reconstruction option you offer to me? Because it can be as simple reconstruction or difficult reconstruction. And you need to know what is advantage of doing this or doing that. For example, you want to do breast recon, okay? Where should I get the tissue? From my tummy, from my back, from my buttock, or just simple as an implant? Just put implant and that's it. So that's a kind of option that what surgeon can use. Okay, so that's a very important question. And then you need to ask whether you can that surgeon can do immediate setting or delayed setting. Which one the best for the patient? And then ask also the surgeon how long the process will take. Sometimes with the technical expertise, 5 hours can be 6 hours, and sometimes very difficult can be 24 hours. I've done a very large reconstruction on the face, need 24 hours, you know, the reconstructive, because it's involved half of the face. We removed it, okay, include part of the brain.
You are doing it in shifts.
Yeah, the staff is shift, but doctor is the same. So we need a team to make it our operation is optimal, at the best optimal, okay? And then as simple as sometimes we have 2 hours reconstructive. From my experience doing short attachment in Korea, the procedure sometimes because this is a new operation, right? Sometimes we take 3 to 4 hours, they can take just only 1 hour, you see? So that's the difference, okay? So that's my personal experience when I see other country doing that. So 50 minutes or 45 to 1 hour must be a very good, very simple or complex reconstructive, but the outcome should be very good because it shorter the OT time, right? So all this very important for patient to know where they want to see, where they want to do, who they want to meet, who are going to advise them, and also post operation, whether the complication, how to manage. If let's say there's a complication, the vessel is thrombosed or it's not functioning well, is there the center have everything to help you to tackle that? Because in a big hospital, it's no problem. If doing a small hospital, then there's problem. And whether it's you have a good stock of blood transfuse, if you need, because it's a major surgery, sometimes we have a loss of blood, so we need to have a backup. So this all a lot of things you need to ask before you do reconstructive surgery.
Dr. Fatimah, it's been a fascinating conversation. I've learned a lot. Thank you very much for taking the time to come on the show.
Okay, thank you, Brian.
I've been plastic and reconstructive surgery and aesthetic surgeon from KPJ Ampang Puteri Specialist Hospital on Biztech's Health and Wellness Show. I'm Brian Fernandez, and this has been presented by KPJ Ampang Puteri social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thank you very much for tuning in.